Welcome to another episode of Med Madness, your go-to resource for mastering medical knowledge. Today we delve into a condition that many patients, especially postpartum women, face: stress urinary incontinence, or SUE. Understanding SUI is crucial for medical students and professionals as it highlights the intricate relationship between childbirth and pelvic floor health. In this episode, we will explore what stress urinary incontinence is, its causes and risk factors, symptoms, diagnostic methods, and treatment options. We'll also share a real-world case study to illustrate the condition's impact and management. Next, let's discuss what stress urinary incontinence is. Stress urinary incontinence is the involuntary leakage of urine during activities that increase intra-abdominal pressure, such as coughing, sneezing, laughing, or physical exertion. This condition often arises due to two main mechanisms: urethral hypermobility and intrinsic sphincteric deficiency. Urethral hypermobility occurs when the pelvic floor muscles, particularly the levator ani complex, weaken and fail to adequately support the bladder and urethra. Intrinsic sphincteric deficiency involves a compromise in the function of the urethral sphincter itself, often exacerbated by a stretch injury to the pudendal nerve during childbirth. These changes prevent the urethra from maintaining a tight seal during increased abdominal pressure, leading to urine leakage. Now, let's move on to the symptoms and clinical presentation. Patients with stress urinary incontinence typically present with complaints of urine leakage during physical activities that exert pressure on the bladder. This includes common actions like coughing, sneezing, laughing, and exercising. The condition is especially prevalent in women who have experienced vaginal delivery, as the trauma from childbirth can significantly weaken the pelvic floor muscles and stretch the pudendal nerve. Other risk factors include obesity and chronic high-impact exercise, both of which can exacerbate the condition by continually stressing the pelvic floor. Next, let's discuss the diagnosis of stress urinary incontinence. Diagnosing stress urinary incontinence involves a comprehensive evaluation that includes a thorough medical history and physical examination. Clinicians often use a variety of diagnostic tools to confirm the diagnosis. One common method is the Valsalva maneuver, where the patient is asked to cough or bear down while the clinician observes for urine leakage. Additional tests may include urodynamic studies to assess bladder function and urethral mobility, and imaging techniques such as ultrasound or MRI to visualize the pelvic floor structures. In some cases, bladder dye testing can help rule out other conditions such as vesicovaginal fistulas, which may present with similar symptoms. Let's move on to the management and treatment of stress urinary incontinence. Managing stress urinary incontinence typically begins with conservative measures. Pelvic floor muscle exercises, commonly known as Kegel exercises, are often recommended to strengthen the muscles that support the bladder and urethra. Lifestyle modifications, such as weight loss and reducing high-impact activities, can also help alleviate symptoms. For patients requiring further intervention, continence pessaries can provide mechanical support to the urethra. In cases where conservative treatments are insufficient, surgical options like the midurethral sling procedure are considered. This surgery involves placing a synthetic mesh under the urethra to provide additional support and reduce hypermobility. While these treatments are generally effective, it is important to monitor for potential complications, such as mesh erosion or infection. Now let's consider a case study to illustrate these concepts. Imagine a postpartum patient who presents with new-onset urine leakage during activities like coughing and sneezing. She delivered her baby vaginally 3 weeks ago. On examination, she exhibits signs of urethral hypermobility, and her medical history suggests a potential stretch injury to the pudendal nerve during childbirth. Initially, she is advised to perform Kegel exercises and is reassured that most cases of postpartum SUI are self-limited, often resolving within 6 weeks as the pelvic floor muscles and nerves heal. However, if her symptoms persist, further interventions, including a continence pessary or surgical options, may be considered. In summary, stress urinary incontinence is a common yet often manageable condition, particularly prevalent in postpartum women. Early diagnosis and appropriate management are crucial for improving patient outcomes. Strengthening pelvic floor muscles through exercises and making lifestyle modifications can significantly alleviate symptoms. In more severe cases, surgical interventions provide effective relief. Remember, understanding and addressing SUI not only enhances patient quality of life, but also exemplifies the importance of comprehensive postpartum care. We encourage you to engage with our pre- and post-podcast quizzes and Anki flashcards to reinforce your learning and ensure a thorough grasp of this important topic. Thank you for joining us on Med Madness. Until next time, stay curious and keep learning.